Okay, welcome everybody. I think we should start. It's now 3 p.m. So first of all, me and Domenica as chairs, we very much want to thank you OHBM for having us, for accepting this symposium. And also we'd like to thank all the audience who have come to this session today. And in the beginning, we give just a very short introduction to the symposium. So a crash course to TMS-ET for anyone who might not be that familiar with the technique. What does it mean? So what you see here is a kind of an artistic view of the second generation TMS-ET measurements, but it's not too far from what we have nowadays in the commercial devices. So on the right, you can see the subject wearing, the subject in this case is having like a TMS coil helmet. In most cases still there is like a more simple coil that is held by hand, but the idea is to drive this strong current pulse through the coil, generate a strong time-varying magnetic field, and that magnetic field then induces an electric field in the brain. The commercial state-of-the-art navigation tools, as you can see here on the left, can then typically visualize somehow the electric field, or at least the maximum of the electric field in real time on the scalp. And that is the way how you can aim the TMS to really like target the region of interest and activate those neurons that you're interested in. And then the idea is to couple this with concurrent EEG measurements. So by measuring how this first focal activity spreads in the cortex through the cortical connections with EEG, we can learn about the true causal connections. And that's the idea you can see here, representation of real-time EEG. And so about 20 years ago, even a little bit more, Ilmoniemi et al., they introduced this kind of concept in this seminal paper where the idea was to study the causal connections. So this is the promise that you activate, pinpoint the region of interest in your cortex with TMS, and then you just follow nicely how that activity spreads. So in these first studies, they were looking at the transcallosal connections between the hemispheres, between the motor cortices. So, and in principle, this should be a flexible method that you could use anywhere in the cortex to activate the region of interest, and then you can map how the causal connections are constructed. Unfortunately, now with these 20 years, we have learned quite a lot about the actual practical challenges related to this method. So first of all, this very strong brief magnetic pulse, not only does it couple with the brain, which is our goal, but also it easily couples with the EEG instrumentation. It can couple with different tissues, so that can create large disturbances and artifacts in the signal that can easily mask the signals of interest if we don't have measures to deal with that. On the other hand, we have learned quite recently that the TMS activates the brain not only directly transcranially, but probably through the sensory inputs due to the vibrating coil, which causes a clicking sound, and possibly direct sensations through the scalp nerves and so forth. On the other hand, we have learned that to actually get a really good signal-to-noise ratio in your TMS-ET measurements, you have to be quite careful in how you exactly place the TMS coil and the electric field. And that's another challenge, kind of a practical challenge. And also, recently, we have started to pay more attention into just how reproducible the different analysis pipelines are and how comparable results do they create, because there are quite a lot of variations in the exact details of the pre-processing pipelines that are used across the groups. So these are kind of examples of the challenges that we are facing today.
Okay, so now I have the nice task of saying that despite all these problems that we have, we might also have some solutions, and this is why we have this symposium today. So we invited some speakers who have solutions to these problems. So we will have Silvia Casarotto, who will talk a little bit about how we can assess online TMS-evoked responses in a way that should minimize confounding factors. Then we will have Pedro Gordon, who is an expert in sham control, so how we can optimize sham conditions. Then we will have Tuomas, of course, who is an expert in how we should analyze at best TMS-EG signal, and then I will give a short example on how we can use TMS-EG together with behavioral data in a way that hopefully complement each other. So one other thing is this is a bit of marketing. So because it's getting so complicated and there are so many ways of doing EG TMS, we put together a group of experts from different labs that are working on TMS-EG, and we are trying to come to a consensus paper or at least to some recommendations. So we are preparing this paper. If you're interested, watch out. It should be published relatively soon. Okay, so I think we can actually start with the talks now, right? Yeah. So our first talk is actually a recording from Silvia Casarotto. She's a research fellow at the Università Statale di Milano in Italy, and she's for sure one of the experts in EG-TMS recording and analysis.
Hello, my name is Silvia Casarotto, and I am a biomedical engineer working in the neurophysiology field at the University of Milan. I'm going to present an EEG-guided TMS approach to obtain a desired cortical activation while minimizing artifacts. TMS-EG is a powerful tool to investigate cortical reactivity. In particular, we have full freedom of choice when setting TMS parameters, including site, intensity, and orientation. However, it is difficult to predict to what extent a certain combination of TMS parameters will actually activate cortical neurons. Nonetheless, we may expect that a direct cortical perturbation produces a local activation that progressively spreads towards distant sites, according to functional as well as anatomical connections. Thus, in principle, if we were able to look at EEG responses in real time, we could better control the TMS impact on the cortex. This approach is routinely applied in the clinics by ultrasound operators when measuring a target organ. A similar approach, implying a real-time adjustment of TMS parameters, is also applied to collect motor evoked potentials from peripheral muscles. We propose to apply this approach to TMS evoked potentials too. To this aim, we recently developed a software tool that provides a customized display of TMS-EG data in real time. But what can we see using this software tool during a real TMS-EG measurement session? At first, we may not see anything because of the pulse artifact, which is spread everywhere and is huge compared to EG activity. Luckily, using state-of-the-art TMS-compatible EEG amplifiers, this artifact lasts a few milliseconds and can be easily masked within our software by replacing it with a flat line. After masking the pulse artifact, we may still see another artifact, which is larger compared to EG, is spread everywhere, and has a weird waveform. It is the recharge artifact. This artifact is produced by recharging of the stimulator's capacitors in between subsequent pulses. Since this usually occurs immediately after pulse delivery, this artifact can be easily removed by delaying via software the time of recharging beyond the temporal window of interest for TMS evoked potentials. After these settings, we may still see an artifact, which is not very big, has a sort of exponential decay waveform lasting a few tenths of milliseconds, and is particularly annoying because it occurs close to the stimulated site. It is the discharge artifact. This artifact is produced by the discharge of capacitances that may appear at the electrode-gel skin interface, and it can be prevented by proper skin preparation. At this point, it is crucial to be able to see single-trial EEG responses to TMS. Why? Because if we are blind at this stage, we may record hundreds of trials, and then, after data analysis, we may realize that data are severely corrupted by a large muscle artifact superimposed to genuine brain activity. Conversely, if we look at single trial data, we immediately recognize a muscle artifact by its large amplitude, its biphasic waveform, followed by a slow return to baseline, and by its lateral topography. If the TMS target is not too lateral, it is easy to reduce this artifact by slight changes in coil rotation, as shown in this example. Starting from this clean single trial, now it is important to be able to see also average responses in real time, because otherwise, if we are blind at this stage, we may record hundreds of trials, and then, after the analysis, we may realize that post-stimulus signal is not significantly different from baseline. But how should we look at average TMS evoked potentials? TEPs are recorded as potential differences between each measuring channel and one common physical reference channel. Thus, their time course is somewhat correlated across channels. In order to be independent from the location of the physical reference, it is useful to apply average re-referencing, that is, to subtract from each channel a linear combination of all channels. However, before re-referencing, it is crucial to reject channels with large artifacts, which would otherwise contaminate all the other channels, and to reject flat channels, which would otherwise be replaced by fake signal. If we apply average reference after rejecting bad channels, we can appreciate the characteristics of genuine EEG responses to TMS, which show larger amplitude in the channels close to the stimulation site compared to distant channels, larger amplitude at early latencies compared to late latencies, larger amplitude in the channels of the stimulated hemisphere compared to the contralateral ones. Now, let's simulate what we could do in a real TMS EEG measurement session, exploiting this real-time EEG result. As an example, let's assume that we aim at obtaining EEG responses to TMS by stimulating the left premotor cortex with a peak-to-peak amplitude of 10 microvolts in the first 50 milliseconds in the channel closest to the stimulation site. So we start from setting TMS intensity at resting hand motor threshold, which is 38% of the maximal stimulator output in this case. Then we adjust noise masking until the subject does not report any auditory perception. Next, we move the coil to the target of the left premotor cortex. Next, we orient the coil perpendicular to the superior frontal gyrus. Now, provided that there are no muscle artifacts on single trial data, we deliver 20 pulses and we look at the corresponding TEP in average reference. We notice that early responses within the first 15 milliseconds are almost absent. Thus, we increase intensity at 120% resting motor threshold. And if muscle artifacts are still absent, we look at the 20 trials average. Here, early responses are detectable, but rather small, without a clear left-right asymmetry in amplitude. In addition, there are larger components with a central distribution without left-right asymmetry in amplitude that might represent auditory evoked potentials. Thus, we further increase stimulation intensity at 130% resting motor threshold, and we adjust noise masking since it was initially titrated at a lower intensity. Here, early responses are clearly visible, are larger on left compared to right channels, and are followed by fast oscillations. Moreover, late, slower, and central components are obliterated. At this stage, we could decide either to further increase stimulation intensity at 145% resting motor threshold and possibly adjust noise masking again, or we could slightly rotate the coil by 30 degrees while keeping previous stimulation intensity. In both cases, we will obtain early responses with an amplitude that matches the desired endpoint, responses that are larger on the left compared to right channels and are followed by fast oscillations. If average TEPs show these characteristics after averaging 20 trials only, at the end of a full session of 150 trials, results can just be better. The EEG responses to TMS obtained with this approach are highly differentiated when stimulating different areas. In addition, they are very different from sensory potentials generated either by auditory stimulation or by electrical stimulation of the skull. These sensory confounds are characterized by a slow time course with a central topography, no matter where the stimulation is applied. Even when stronger electrical stimuli are delivered, the response does not significantly change, except for a larger amplitude. The take-home message of this talk is that using a real-time EEG readout allows to check and improve TMS evoked potential's quality before collecting real data. Thank you very much for your attention.
So thank you very much, Silvia. We don't have any questions at this stage, and anyway, if we will see if we have time in the end to have discussion related to Silvia's talk. But I think we should now move forward to the first live talk for today. And it's my pleasure to welcome Dr. Petro Gordon, who is a psychiatrist and a postdoc in the neurology department of the University of Tübingen. Petro has done a lot of research in the use of TMS-EEG for probing and modulating cognitive functions, as well as investigating the TMS-EEG methodology itself, which is the focus of today's topic. So thank you, Petro, for coming, and you're welcome.
Thank you for the introduction, Thomas. So let's recap what this is all about. This is about using TMS, focal stimulation in the cortex, and retrieving information with EEG, as Thomas suggested in his introductory talk. and the interesting thing about that is that we can then probe a specific region of the cortex and get a response, which will then tell us something about the state of this cortex, and we can then compare maybe different interventions, we can compare different conditions that will tell us about what is the state of this cortex when we stimulate. However, as anyone who ever used TMS would know, TMS also produces a lot of sensory stimuli. The click sound, the scalp sensation, which obviously will also create a potential, which will then confound the results. So the idea is that to answer how much this influences the EEG results that we get, and what can we do about this? And this is what I'm going to try to talk about today, the impacts of this phenomena in TMS-EEG studies. The proposed approach is to tackle this, its faults, then what we propose to do with this, and then future directions to take from. So first of all, the idea that this might be a thing, that this peripherally evoked potentials or peripherally evoked responses might contaminate EEG data in TMS-EEG studies actually came about right after this, the TMS-EEG was developed in the late 90s. It hasn't been explored much up until recently, and I don't know why, because the thing is, if you look at the data in some studies, if you compare, for instance, the EEG response to TMS applied in different, with different angulations, on the top, TMS orthogonal to the cortical, to the frontal, to the superior frontal cortex, with the orientation parallel here in the middle, and compare those to a sham condition in which you just create the sensory stimuli but without the proper direct stimulation of the cortex, you can see that they look pretty similar. So much that one might be even excused to think, well, maybe everything that we see here is this peripherally evoked potential. There is no real cortical activation by the TMS, or at least not anything that we can actually see in the EEG response. So what is that about? Well, first of all, let's try to understand what is this peripherally evoked responses that we see in TMS-EEG. And those are simply evoke-related potentials. So you apply any sensory stimulus, regardless of what it is. It can be auditory, somatosensory, visual. You will evoke a potential. Biggest amplitudes around 100 milliseconds after the stimulus, and then 200 after the stimulus. This is usually, sometimes you call it the N100 P200 complex, most visible in central electrodes. And this is supramodal. It doesn't matter which kind of stimulus you apply, because this is most likely the cortical response to bottom-up attention modulation. So this you will see if you deliver any kind of stimulus, and there are a lot of those sensory stimulus in TMS. You have the click sound. You want to stimulate the cortex with the TMS, but there's between the coil and the cortex, there's also skin, and the skin will feel the pulse. And if there are muscles, depending on the region of the cortex that you want to stimulate, if there are muscles in between or near it, they will also contract, creating more sensation and therefore a higher amplitude event-related potential. So, what is the consequence of this? The consequence is that, well, if I then use TMS-EEG to, for instance, probe the cortical modulation to a substance that I'm experimenting, or, for instance, a disease, see if the TMS EEG responses in a clinical sample is different from a healthy one, well, what you're seeing then, is it the modulation of this direct focal stimulation of the cortex, or is it just this, the modulation of this event-related potential? So for example here, we have these two studies. Just for example, the study on the left is TMS EEG comparing a sample of patients with attention deficit disorder and healthy controls. And they saw that the clinical sample exhibited a smaller amplitude N100 compared to the healthy controls. And similarly, this on the right, it's a pharmaco TMS EEG experiment. It was just healthy subjects, but they gave some benzodiazepines for these subjects. And they found that the benzodiazepine also decreased the amplitude of the N100. And then if I go back here and say, well, the N100 might only be this peripherally evoked response. So are you here seeing a modulation of this specifically TMS focal evoked responses that Sylvia was showing, or is it just modulation of peripherally evoked responses? Well, you can't do this here because you cannot know for sure here because there is no control condition. But if you look at other studies, you'll see that these exact two conditions, both ADHD and diazepam intake, they are also related to decrease of the N100 when the N100 was evoked by sensory stimuli. So this is complicated, and this is definitely require action to disentangle these two responses. The response from peripherally evoked potential and real TMS evoked potentials. So typically this has been tackled like this. We need a control condition. So you do the TMS EEG with your real coil, but at the same time you also apply stimuli using a sham condition. A sham condition that will recreate all the sensory stimuli of the real TMS, but without the direct cortical stimulation that the TMS does. So you can then here control for the auditory impulse using a sham coil, and for the somatosensory input, the scalp and muscle sensation using scalp electrical stimulation. And I forgot to mention, another way of doing this is for the click sound is using masking noise. So basically, as a way to blur the perception of the TMS click, you use a masking noise so that the individual is not going to hear the click, therefore no meaningful sensory input. Silvia Casarotto's group developed an app for that, for creating a masking noise specific for the type of coil that you're using. I tried this, it works, it's great, and I recommend it. However, some people still can hear something together with the masking noise. Maybe because the stimulation was too intense, the click was too loud, people can still hear it. So maybe it might be also a good idea to pair it with a sham coil to take this into account. You cannot do masking noise or anything like this for the somatosensory input. You can maybe use a nerve blocking, but that will be uncomfortable and complicated, so no. The best way people came up with was to create an electrostimulation on the scalp that will recreate this, the sensation on the scalp by the TMS. And that's what people have been doing in the past few years, using this kind of idea to try to recreate the sensory input from TMS as a control condition. However, it's hard. And people haven't been very successful because, for instance, it's very hard to create, to perfectly pair the sensory stimulus from the TMS and the sensory stimulus from the sham coil. People can tell the difference. And if people can tell the difference, what may happen is that indeed, when you do your study, you find that your sham condition generates a peripherally evoked response that does not really match the one from the TMS. So some studies have kind of fell short on that, including one by yours truly. Right, so if this is the case, what happens is if you do not pair properly, you'll compare the two, and what you'll see is a response that still contains remains of this peripherally evoked response that you might be tempted to interpret as the real TMS response. And if there's modulation of this, you might say, ha, there you go, I see here a response, a modulation of the focal TMS activation of the cortex when it's just the peripherally evoked response that you don't need. So you don't need a TMS. You can just do this with a click sound or with a peripherally electrical stimulation. So if you say, well, then I will just crank up the intensity of the sham. Well, then you don't solve the problem. You just inverted the sign of your problem, and it's still there. Ideally, you'll create this perfect, realistic sham condition that perfectly pairs the event-related potential from the TMS. But as I said, it's hard. We try this many times. You put the electrodes there. You try different kind of arrangements. You try different kinds of intensities. You get to a point when the subject says, okay, I can see that this intensity, this stimulation is very similar to the one of the real TMS, but it still feels different. It has a different taste to it. And if it's the case, if it's still different, then you will not move. You will still have the same problem. How can we create this perfect sham? So that was my question. How can we do this? And I ended up giving up. I can't. There's no way to do this. So what I did was something different. What I did was to say, okay, what if we then instead we use an electrical simulation of an intensity way beyond what is expected in both the sham and the real condition? And why the hell would I do this? Well, it's based on on how we perceive things, on how the sensory input processes information. Basically, it means that we perceive things logarithmically. If I increase the sensory input linearly, there will be a logarithmic increase in the neurophysiological response. I'm not going to go too much into details in this, but this is a very interesting area in psychophysics. But this is the idea behind it, because then what I do is if I, instead of using a sham and a real, I use a very high intensity sham, which I use in both sham and real condition. Even if in the real condition there is an objectively higher sensory input, this difference will be negligible. And if I then compare the two, even if the evoked response is very large, if I subtract both, I would get only the true response from the direct activation by the TMS. So to try this out, I used this electrode montage, and I kept increasing the intensity up until the response was not, the response did not yield a significant difference in the amplitude of the evoked potential. And in this sample, using this setup, this was around 300% the individual's sensory threshold. And you can see here, using auditory input only, this is with the masking noise. So this is an example of relative success of using the masking noise. It pretty much made it a horizontal, no response there. A few subjects could still hear. That's why you can see there in the P200, there's a tiny amplitude, probably because some subjects could still hear something beneath the masking noise, but overall very different from the evoked potentials from increasing amplitude of the sensory stimulus. All right, so if I take this intensity and this overall setup, when I use high sham intensity in both real and a sham, I can then stimulate the primary motor cortex and get your usual N100, P200. But then, if I subtract both, I would get something that can only be attributed to the direct cortical stimulation. And as Sylvia suggested, it's a very early potential. And you can even see something in the area that's supposed to be occluded by the sensory evoked potential. And the same thing can be done in the time frequency analysis, here using the induced oscillations. You can see that induced oscillations by both sham and the real are broadband increases in the amplitude. But if you subtract both, what you'll see is just this particular increase in the beta frequency band right atop this stimulated area. This is in line with the idea that what you're doing is that you're pinging the cortical thalamic network, which is then responding in the beta frequency band right in the stimulated area. And we are using this to further studies. Here is Yufei Song, who is a PhD student of our lab, who is also applying the same idea to then probe the response from other cortical targets. So this is it. This is not set in stone. This is our way to tackle this, this problem. It's not a perfect one. Ideally, one would be able to create a one-size-fits-all solution, which is not, because if you're if you're using very high sensitivity inputs, which is, for instance, when you're using high TMS intensities, maybe if you're trying to stimulate the cerebellum, which has a lot of muscles, it will respond with a lot of sensitive inputs. You need very high sham intensities, which might make it a bit uncomfortable or unfeasible. So this should be kept in mind. Up until someone maybe develop a truly realistic sham, this is open for research. If someone has a better idea of how to create this perfect realistic sham, I'm all ears. But up until then, we can already use these to very reliably see if the previous studies could actually investigate the response from focal stimulation. So were those studies done before? Could those be replicated? And would the results remain if we control kind of perfectly for this event-related potentials? This is another thing. But up until then, I thank you for your attention.
Thank you very much, Pedro. So there are two questions which are both kind of related to the adverse effects. So does this like high sensory sham, does it have like adverse effects? Is it painful or?
If the sham has adverse effects?
Yes.
It might be uncomfortable for some people. Some people might find it annoying, especially if you're using high intensities. For instance, if you do this for the motor cortex, you don't have to use very high intensities. But we try to do this with the cerebellum. This is very hard because if you're using TMS to stimulate the cerebellum, you're going to evoke a lot of sensory. It's a lot of sensory input. So for you to perfectly saturate the sensory network using high intensity electrostimulation, that will be very difficult to do. But other than that, I don't think there is any other side effect to it.
Yeah, I think we are a little bit short on time, so
right.
we can move to the next presentation, and then at the end, if we have time, we can go back to the questions. Thanks a lot, Pedro. Okay, so now it's my pleasure to introduce Tuomas Mutanen, who's a postdoc at Aalto University in Finland. And he's the guy to go to when you don't know how to analyze your data, because he's an expert of TMS-EG data analysis. Thanks, Tuomas.
Hi again. Without further ado, as you have now learned today, like it is, there can be a lot of artifacts and noise signals related to the TMS pulse that we are not interested in. And today I'm going to talk about how to deal with the TMS-EG data when you do have these disturbances, to really be able to uncover the signals of interest coming from the cortex. So overall, I will present mainly methods that are based on source modeling. So I will first cover, introduce why source modeling could be interesting in the context of artifact and noise removal. Then I will present a couple of applications for, in particular, TMS-EG. And one interesting question that is always related to artifact correction is that, okay, how can we make sure that we are not actually suppressing our signals of interest too much? And I will give you some ideas about controlling the possible overcorrection. And then, if we have time in the end, I want to give you a couple of words about the replicability between different data analysis conventions, in particular in the TMS-EG field. Okay, there seems to be. Okay, great. So why would you like to do source modeling? So basically, we know quite a lot about the physics and physiology of the EEG. So the source modeling basically means that we calculate in advance, taking into account the conductivity structure of the head and the current form of those post-synaptic currents that we think we are measuring in EEG, and calculate what kind of topographies or voltage patterns would you expect from intracranial current sources. And this can, of course, be useful in noise cancellation, because most of the noise and artifact sources actually do come from extracranial sources. So we can use this information in order to disentangle the noise and artifacts from the signals of interest. So let's go directly to the deep end. So one of the main problems with TMS is that it can activate the muscles in the scalp. So especially if we start to stimulate the more lateral areas. As I explained to you earlier, like ideally we would want to have a method where we could pinpoint any area in the head or brain, activate that with TMS and measure the effective connections. Unfortunately, on the right you can see the map kind of showing how the difficulty level depends on the stimulation location. So really we do get the best signals close to the vertex of the head, and this is obviously a problem. On the left-hand side, you can see the typical muscle artifacts that you might record with TMS-EG. So there's a big biphasic deflection in the beginning of the signal, and this can easily mask the most interesting transcranially evoked potentials in the cortex. I would also ask you to pay attention to the topographical shape of the muscle artifacts. So we can see that it clearly has this like a very temporal emphasis and or lateral emphasis, and the topography has much higher spatial frequencies than what you would expect from the cortical EEG topography. So on the right hand side we can see a bunch of topographies that are based on modeling work. So we have modeled with different conductive assumptions, but overall, like most of those assumptions lead into topographies that have much lower spatial frequencies than you would expect from the muscular artifacts. So because the muscle artifact is present in many channels at the same time, it doesn't really make sense to start rejecting bad channels per se, but rather we want to remove those signal dimensions that capture, or topographies that capture most of the muscular artifacts. So we need a trick how to find these topographies, and we actually do have quite a nice trick. And the trick is that we look into the spectral composition of our signal, and because these muscles are actually from the extracranial sources, they tend to have much broader frequency band in EEG than the intracranial current sources. So what we do is that we actually first high-pass filter our data to get only muscle artifacts. And from this high-pass filtered data, you can estimate those topographies that you want to remove. And the signal space projection is a beautiful method for projecting out these topographies. So already 10 years ago, it was shown that the SSP is able to remove and suppress these muscle artifacts. The problem is that after removing these kind of arbitrary topographies or signal dimensions, the signals that we have in the EEG are not really easy to interpret anymore, because those time courses, they don't anymore correspond to the actual physical locations of the EEG channels. They are more just like these arbitrary combinations of the original signals. But there's a neat trick that you can do also to correct that. So the trick is that we project out our artifact topographies, but this is perfectly well known or well defined, so we know exactly which topographies we have removed. And we can take this linear transformation into account in minimum norm estimates or some sort of source estimation and calculate the currents in the cortex that would produce those artifact-free EEG signals. And because we have our source model ready, or forward model, we can then calculate backwards to extrapolate those artifact-free information or signals in the original signal space. And in short, you can write this in one line of code or equation. So that's handy for many purposes, as you will see. Here you can see just example signal, how the data looks like. So the red ones are the original signals before the muscle artifact rejection, and the black ones are the uncovered signals. And on the bottom you can see the topographies, how we can uncover these topographies even at the early latencies that you could imagine that are coming from the stimulation location close to the left primary motor cortex, if we compare that to our model. One cool thing about this SSP-SIR approach is that it's not really restricted to muscle artifacts per se. So if you have a way to measure your artifact topographies, you can generalize this quite well. So what we tried with Biabani and others was to actually have sham control for the PEPs that you just learned about. In that case, we had a very simple sham. It was just the shoulder stimulation. But we wanted to test what kind of outcomes you would get if you would use this method to project out those peripheral evoked potential patterns. And well, you can see that the topographies change. But what I would like to show is this is maybe more kind of informative or interesting, is that if we compare the shoulder stimulation and the M1 stimulation source estimates directly, it's kind of disturbing how similar patterns of sources we observe. But then after suppressing or projecting out these peripheral evoked potentials, we actually uncover a quite different pattern in the cortical source space that is really like emphasized on the motor system, covering supplementary and premotor areas and so forth. So it kind of looks interesting. The other algorithm that we have put a lot of effort recently is the so-called source-utilized noise discarding algorithm. And I will not go into too much detail, but the idea is very much related to the SSP-SIR that I explained. So what we do is that we cross-validate the channels in an iterative scheme where we do multiple inverse and forward calculations. And based on this cross-validation, we can figure out which channels are most noisy and construct again a spatial linear filter that you can apply to your data. And so as a result, you get a very simple relation, very simple operation that, and this is valuable actually for many practical purposes. And you can see some example TMS-EEG data. This is, by the way, completely general method, so there's no way why you couldn't use it to MEG, EEG, but of course in this talk we are concentrating more on TMS-EEG. So you can see on the top row the data before and after sound. The sound has automatically found the bad channels and cleans them. And then on the bottom row you can see the noise distribution map. And the corresponding channels before and after clean. So why is it valuable that it's a simple linear filter that we can just operate our data from the left? Well, it comes handy to methods like real-time cleaning. So one emerging field for the TMS-EEG is actually EEG-informed TMS, where we want to stimulate the cortex at the correct brain stage. And we use real-time EEG for doing this. But even real-time EEG, it can be quite noisy. So if we have methods how we could actually filter the streaming data, that could be very valuable. So what we tested in this recent small paper with Mutanen et al. Was that what if we would have raw data streaming in, and we would have an additional asynchronous process where we would kind of read data to a buffer, and within that asynchronous process we would do the sound algorithm to find the current noise distribution. And then once that update is ready, we have the best possible idea for the most recent noise, and we can just update our spatial sound filter, and we keep filtering each of the streaming data samples, because this is such a fast process, it's very feasible for real-time computations. And well, here's just some example data. So showing that it does effectively notice in real time the bad contaminated channels and can clean them. It's nice that because during the recordings you can easily have channels that kind of become bad. They become detached from the scalp. So then it's nice if you have a real-time method that can actually that can respond to these changes. But this is still ongoing work, and we actually got a recently small grant for concentrating on this real-time cleanings. So one concern, major concern, of course, in these methods is how do we know that we are not corrupting our signals of interest? And then again, I think source modeling or forward modeling can be a very valuable tool, because if we have this type of simple spatial filters that you can just operate from the left to our data, but you can ask that even if we don't have the ground truth signal, you can ask that, okay, let's assume that we would have, anywhere in the cortex we might have some activity. How much would those activities be suppressed or corrupted by our filtering methods? And you basically get a map that shows how much overcorrection as a function of the cortical location you do have. And oftentimes if you have, for instance, big muscle artifacts in TMS-EEG, it does mean that close to the stimulation site, you do suppress quite a bit those sources. But then on the other side, on the flip side, is that if you are actually interested in mapping causal connections, especially to the contralateral hemisphere, the story becomes a little bit more optimistic. So actually we can oftentimes see that on the contralateral hemisphere, the sources are much less suppressed. So even in difficult cases, you might actually see a shed of light that maybe I can measure the connection to the remote areas of interest. And then I think I have still a couple of minutes. So what we have now paid a little bit more attention to recently is that many research groups, also in the TMS-EEG field, are using their own custom scripts and quite complex cascades of cleaning processes or pipelines. So how reproducible are these most popular TMS-EEG pre-processing pipelines? And in short, I can tell you that they are not really reproducible. So you do get, at least in our example data, you do get quite substantial differences if the data quality is not that great. So in this data that you had to clean quite a bit, and these different approaches either emphasizing independent component analysis or the methods that I just described, or even different flavors of independent component analysis, they do actually contribute and cause significant differences between these outcomes. And this is something that we should, as a community, really try to solve. It's even worse in the sense that in this recent paper with Nigel Rogas et al., we just studied a single data processing step, just cleaning those decay artifacts that you saw in Silvia Casarotto's talk, these depolarizations. So we used 3 different methods to just clean this depolarization artifact, and we got differences after this one simple step. So the take-home message is that there are differences, and the devil is really on the details. So we need to understand, we need to dig into the details on each step, and also try to understand how the different steps, how they interact with one another. And we might need some sort of translational methods, like combining real EEG measurements with simulations to learn about what is the best method or how to correctly combine these and what are the possible pitfalls. So that's it. Those are my conclusions. Basically, I hope that I convinced you in this quite rapid fire talk that the source modeling can be really useful and helpful in the correcting the TMS-EG data from various disturbances and noise signals. But also, I would like to alarm you that at the moment there is some uncertainty about the rich data analysis methods that we are using when we are trying to compare the results among the groups. And we should have some sort of like a collaborative approach trying to solve this issue. So that's all from me. Thank you very much. Are there any questions at this point?
Yes, Tuomas, there is one that is very popular. So I'm going to ask you just one question, and is, what are the strengths of these noise filtering methods compared to ICA artifact removal?
Okay, so because we don't have the ground truth, that is one challenge, like to actually objectively compare the different methods. But what personally concerns me about using independent component analysis in TMS-EG type of data is that we have heavily time-locked signals. And ICA is constructed with the assumption that the components are independent, statistically independent from one another. And I am concerned that artifacts such as the muscle artifacts, which are heavily time-locked, actually do accidentally mix with the neural responses. So that's why I would be quite conservative when it comes to time-locked artifacts. Then there are a set of artifacts where I think ICA is much better suited, like ocular artifacts that do happen spontaneously and more randomly and can be assumed to be more independent. So I think that's it's hard to compare them at the moment objectively, but I think these methods that I described, they at least give you options in addition to the assuming statistical independence between the components. I think we definitely have to move on so that we get a reasonable amount of time to Domenica. So the last but the best the speaker is Domenica Veniero. Mimma is currently working as an assistant professor in the University of Nottingham. Despite of her young age, she has already done years and years of extensive TMS-EG studies, and what I think is really groundbreaking from her recent studies is the combination of behavioral data to TMS-EG data to really try to nail down those truly causal connections. So I will be really pleased to hear her talk.
Okay. Thanks, Tuomas. You're too good. Okay, so I will go straight to the point. So my talk is going to be a little bit different because I was interested in a specific question. So I will move away from methodology and towards cognition a little bit. So as you might know already, brain oscillations are being proposed to be a mechanism through which different brain areas can be linked to form a neural assembly very quickly. And yeah, you might also know already that the brain is also able to generate a variety of oscillations, and we usually classify them according to their frequency. So for example, here we have beta, alpha, and so on. But another feature that I find particularly interesting in these oscillations is their phase. And the reason why I find the phase particularly interesting is that it has been proposed that phase is an index of excitability. So in my example here, I think this is an alpha oscillation. You can see that there is a phase, which will be this one, which can be referred to as the good phase. And in that moment in time, we can see that there are a lot of spikes, which means that the cortex that is generating that oscillations is quite active. So for example, if we are looking at the visual cortex and we show participants a visual stimulus, it's very likely that at that phase, participants are going to say, yes, I've perceived that stimulus. However, there is also a bad phase, which is the other one, on the right. If we present the same visual probe at that phase, it's very likely the participant will not perceive the stimulus because there's no spikes or a reduced amount of spikes. So this means that the cortex is less excitable. So just a few starting points. I was particularly interested in this study to understand how an area, which is the frontal eye fields, which is a main node of the attentional network, how can this area control the visual cortex? We know already from other studies that the frontal eye field is generating top-down attentional signal that are able to influence somehow the visual areas. We also know that by definition, attention, which is the mechanism I was particularly interested in, what it does is it facilitates the processing of stimuli that fall within the attended location. So I put everything together. So if you think about definition of phase and the definition of attention, the idea here is that the frontal eye fields can actually generate these top-down signals that will play on the phase of the oscillations that are generated within the visual cortex. And one of the advantages of moving the phase or playing with the phase is that the frontal field can entrain or move the phase of the activity within the visual cortex in a way that the visual cortex and the frontal field will be in the same good phase or the same bad phase. And in this way, they can talk in an effective way. And the other thing is, if you think about it, the definition of phase, if the frontal field is able to shift the phase of the visual cortex, this also means that it can control the excitability of the visual cortex and therefore can kind of decide the fate of the incoming visual stimuli. So this is in the visual area, but I think a similar mechanism is actually at play in other modalities and other systems. So I was looking at the literature and I found a series of very interesting papers by Moore and Fala, where they stimulate monkeys with electrical stimulation of the frontal fields, and what they found out is that if they stimulate the frontal fields, or if they ask the animal, that sounds weird, but if the animal is shifting the attention voluntarily, they get exactly the same profile of spikes that you can see in the middle. So the idea here is let's use TMS to activate the frontal fields in the same way as in Moore paper. And the idea is that by activating the frontal fields, we're actually forcing that area to generate an attentional impulse or a top-down signal. At the same time, we thought, okay, let's put together TMS and EEG in a way that we can trace what happens when we force the frontal fields to generate this signal. And the nice thing, as you know, if you're interested in TMS-EEG, is that we have no uncertainty in this case about direction, because by design, we know already which area is starting the communication. So in this case, the frontal fields, which is the black dot on the top, becomes the sending area by design, and any area that is connected to the frontal fields will become the receiving area. So as I said, the aim of this study is to test how the frontal field can control visual areas. And we had like a very specific hypothesis. So the idea is that the frontal fields control the visual areas by phase resetting the oscillatory activity of these areas. I'm going to show you a picture. This is the hypothesis, like visual hypothesis. So the vertical black line in this picture is the moment when the signal from the frontal field is reaching the visual cortex. And as you can see at that moment, the oscillatory activity of the visual cortex, which is this green line, start to oscillate at a specific phase. So if this is true, we thought, okay, it doesn't matter how we are going to measure what's happening after this signal reached the visual cortex, we should always be able to find an oscillation. And I will explain you better in a minute. So experiment number one is TMS and EEG experiment. The question is, are signals generated in the frontal fields changing the occipital cortex activity by changing the phase of the oscillatory activity generated within the visual area? So we did a very simple TMS-CG experiment. We stimulated the frontal fields with the idea of tracing what was happening in other areas. So it's just a single pulse applied into conditions of real or sham stimulation. Sorry, it was like a very basic sham, so it's just the sound. Participants were just fixating on fixation cross, and we compared sham and FEF stimulation on the ability of phase resetting the oscillatory activity. So these are the results. So what I'm showing you here is an average of all 62 channels. And the index that I'm plotting is called intertrial phase coherence, which is telling us how much phase coherence there is. And in a way is an indirect way of saying that there is a phase reset. So the 0 on the x-axis is the TMS stimulation. And as you can see, if we put together the electrodes, there is a very big response pretty much everywhere. But if we look at specific frequency bands, you can see that around 29 hertz, which is the green line, the topography seems to indicate the frontal fields that we have stimulated. I forgot to mention that we stimulated the frontal fields on the right. If we look at the beta frequency, which is around 15 hertz in these results, the topography seems to indicate that it's on the occipital electrodes, something going on maybe in the visual cortex. And then if we look at the alpha frequency, we found something that has a topography on the contralateral motor cortex, more or less, contralateral to the stimulated side. I'm not going to talk about anything else because what I was really interested in is these. So it's exactly the same result, but now I'm showing you just the occipital electrodes and these beta that we found. So if we compare sham and real stimulation, what we see is that the real stimulation generates a phase reset as indexed by this increase in phase coherence. This is significant and nicely showing that it's over the right electrodes, so over the occipital electrodes. So then we wanted also to know if it's a real oscillation. So you know maybe that there is like a big debate in the field where if you present an increase in oscillation or anything that's related to oscillation, now you should also provide some evidence that it's actually a real oscillation. So we use this method, which is called Best oscillation, BOSC, that is meant to retain whatever is cyclic, so an oscillation, and reject anything that is non-repeating over time. I'm not going to spend too many words, but the solid line is the real stimulation and the dashed line is the sham stimulation. And you can see for the occipital electrodes, for the band that we found to be significant in the previous results, so from 8 hertz to 24, what you see here is that there is a real oscillation in the beta band over these electrodes. And then we said, okay, this is like a starting point. Is there a real consequence to this phase reset that we're seeing? So we took the GTMS data as a starting point, not like the end of the experiment. So we thought, okay, let's see what happens if we ask participants to discriminate dots. So we asked them to tell us whether the dots were moving to the left or the right. It's pretty standard. We know that this activates the visual cortex. The TMS here is, oops, sorry. The TMS is here. And then the dots would appear at different intervals. So TMS over the frontal fields, then the dots. And the dots could appear anywhere in, I think, 300 millisecond window. Yeah. So you remember my hypothesis at the beginning, I said if there is a real oscillation that is started by the frontal fields, the signal, the black vertical line, no matter how I'm tracing this oscillation, I should always be able to see it. So basically what we did is we presented the dots at each of these time points. And we wanted to see if the performance of our participant was also fluctuating over time following a beta oscillation. Yeah. So these are the results. We had 2 windows, but we can focus on the first one because they're identical. So we presented the dots anywhere from the stimulation, which is 0 on this axis, until 200 milliseconds. you can see how accurate the participants are. And you can also see that their accuracy is going up and down over time. And then we looked at the spectral content of their performance, and we saw that actually this oscillation in behavior is a beta frequency, so it's matching what we were seeing in the TMS-EG data. And here the final plot, the polar plot, is saying that participants tend to be in the same phase, but that's fine. And then we asked ourselves, okay, are these TMS-EG results actually related to behavioral results? We had the same participants doing both. And what we found is that actually they are related. So there is a correlation, a significant correlation between the phase that we found in the EG-TMS data and the phase we found in the behavioral data. So there is a match. And then we thought, okay, what is actually changing over time? And we thought maybe it's the excitability of the visual cortex, so we planned another experiment. In this case, the frontal fields are stimulated, and then after some time, the visual cortex is stimulated, and participants are asked to report whether they perceive phosphines. So I don't know if you're familiar, but phosphines are a measure of excitability. The more phosphines means that the visual cortex is more excitable. So the design is actually the same. So you can see here there's the stimulation of the frontal fields, and then once again we tested the excitability of the visual cortex at different time points. The idea is that if there is a real phase reset and a real oscillation started by the frontal fields, we should be able to see that the phosphines are also oscillating over time. Yeah, forgot again. We also wanted to have two more questions. The first one was which visual area is actually influenced. So we tested frontal fields and V5. And then in a different experiment, it was frontal fields and V1. And then we also wanted the control condition, which was CZ V5 and CZ V1. So let's see the results. So once again, you can see the amount of perceived phosphines as a function of the delay from the stimulation of the frontal fields. And you can see on the left, there's the FEF V5, on the right, CZ V5. And you can see that, at least for the one on the left, there is this pattern. So phosphines, the amount of phosphines is going up and down over time. Yes, spoiler alert, it's again in the beta frequency. Here on the right is just to show you how a 17 hertz would look like on the CZ V5 condition. But you can clearly see that at least for 2 cycles on the left, there is a nice fit, which is not present here. Let's see a little bit of statistics. So the first thing, of course, CZ has to be, well, the real stimulation, FEF V5, should be different from CZ V5 because we do not expect any connection between CZ and V5, and that's the case. That's what this is telling us. So these two conditions are actually different for beta frequency again. And then here I'm just showing you again for each individual participant how the phosphine look like. And as you can see, all of them are oscillating around 17 hertz. And this is the formal spectral content of their behavioral performance, which is still in the beta frequency. And the polar plot is saying that they are more or less in the same phase. So TMS of the frontal field seems to reset the phase of the oscillation in V5. It's just window 2, but we can skip because I feel like we are at the end. And then we repeated everything with CZ V1 against FEF V1. And unfortunately, we found no difference between CZ and FEF. So we didn't do any other analysis because this was the first thing to test. The same is true over time, a bigger time window. So just to conclude, in the experiment 1, we found that the activation of the right frontal field triggers a phase reorganization of the beta activity over the occipital electrodes. Experiment 2 and 3, where we present either dots or we ask for phosphines perception, again, seems to show that this beta reset is perceptually relevant. So FEF activation caused a cyclic modulation of visual perception and visual cortex excitability. And then we also proved that there is an anatomic specificity because the frontal fields could only influence V5, but could not influence V1. And the other important point is that when we replace FEF with CZ, we found no effect. So the results of these 4 experiments provide converging evidence that top-down control from the frontal fields on visual cortex is implemented through a phase realignment of neural oscillation at beta frequency. And because our participants were not doing a real task in a way, or we are looking at very simple tasks in some cases, we believe that this might be a fundamental mechanism of top-down control. And I want to thank you for your attention and thank my collaborator from the University of Glasgow, in particular, Gregor Tut. Yeah, thank you.
So we are already over time. I would like to say that we are all really outgoing people, so please feel free to disturb us after the talk. If you have open questions, we are really happy to answer. Do you want one question? So I guess we could have one question for Mimma, because it was just a great talk. There was a question whether did you look at any functional connectivity between the frontal eye fields and the occipital regions in addition to the effective connection?
No, unfortunately I did not, because at the time, there was no time, and also I'm a little bit skeptical of EEG and connectivity measures. So no, I didn't.
Okay, so thank you very much for your interest.
Thank you.
We will be really happy to continue discussion after the session.